bring in Dr. Joshua Barocas. He's an assistant professor of medicine at the Boston University School of Medicine and infectious diseases physician at Boston Medical Center. Dr. Barocas, thank you for taking time with us this morning. You obviously up in Boston have a collection of some of the very best hospitals in the world. Just give us a snapshot. We gave a little bit of the information there of what it looks like in those emergency rooms, what it looks like in those ICUs up in Boston right now as it relates to coronavirus.
So they're crowded. The people are, I would say that there's not necessarily chaos, and I want to project as much calm as humanly possible. Our nurses and our doctors and our entire staff are doing an amazing job at projecting that calm, at remaining calm, and sort of implementing what they've learned to do over years of training. That said, there's a constant influx of patients. I'm on the phone constantly with the discharge planners trying to figure out when someone can be discharged, where they can be discharged to, if it's safe to be discharged. This is a total team effort, and it's taking a lot of human resource right now, as well as tangible resources.
We've heard specifically in New York City, but across the country, about the desperate need in hospitals for PPE, personal protective equipment, masks, gowns, gloves, booties, things like that. Where does that stand at your hospital and hospitals up in Boston? How desperate is the need there?
This is an ongoing discussion every day in our section, and I know that across the hospital. Currently, we have a mask policy in place here at Boston Medical Center, which is consistent with what's happening at Mass General across town, where we're giving workers a mask to use for the day. We currently have a supply that is adequate for the time being, but looking at projections, we really have to think about where we're headed, and it doesn't necessarily look good. As many of your guests have already said, the supply chains are difficult. Yesterday, I was watching Governor Baker give a press conference, and it was clear his frustration with the supply chain. And I'm certainly not speaking for the governor. It was just, as a constituent, it was actually somewhat reassuring to know that we were at least all in this together here in Massachusetts.
Dr. Barocas, I was struck by something you posted on social media where you said, as you prepare to leave your wife and your kids for a while and go into these ICUs and these emergency rooms, you said, I am scared, but my community needs me, which is what I've heard from doctors across the country, and why you all are rightfully being called heroes for what you're doing. You have right now an audience. President Trump is tangling with governors, but he does seem to listen to doctors, people who are in the fight directly. What would you say, not just to the president, but to the federal government? What do you need at your hospital, and how soon do you need it?
So we're thinking of things in three terms: space, staff, and stuff. So right now, our governor is working, and our mayor is working to find space for all of the healthcare workers that may need to be quarantined, and also all of our vulnerable populations here in Massachusetts, people who are experiencing homelessness, and making sure that they have a safe place to go. With regard to staff, we need the president and the federal government to be in line with this idea that we're not anywhere ahead of this yet. We're still on the upslope of the curve. And so we need to make sure that the community and the public knows that the best thing they can do to protect the staff is to stay at home, to wash their hands, to practice social distancing, all of the things that we've been saying for weeks. And then finally, we need stuff. The supply chains are, I know, a difficult thing. We have a group of BU medical students and residents who are collecting masks and N95s from the community, where I've seen this across the country. And I really think that right now, unless there's a big shift in how we get masks and other PPE to our healthcare workers, we're going to have problems with the other two S's, the other two staff and stuff, the staff and the space.
Well, Dr. Joshua Brokus, I know the people of Boston are grateful and the country is grateful for people like you. We appreciate you taking some time. I know how busy it is for you right now. Thanks for being here and thanks for all you're doing.
My pleasure. Thank you.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.